Maybe you can briefly explain what exactly is BHN providing and how is it different from your competitors?
Great question. We work with the health plans, and that's one of the big things that distinguish us. And we work to identify gaps in the marketplace. So, for example, in 2012, for the first time in when I first started to purchase the company, the biggest thing that happened was healthcare reform. Healthcare reform, it was the first time in America's history that someone underneath the age of 65 can have an insurance card, go to the hospital and get cared for, go to primary care. And we learned from the lessons of Boston, Massachusetts, before the healthcare reform was passed and started being implemented in Illinois, our state. And what we learned from Massachusetts was the first wave of people that get this card in their hands is going to go to the ER first thing to get cared for. And there's going to be influx of ER utilization. Now, when healthcare reform, and where are they going to go after the ER? Where are they going to go after going to the hospital? They're going to go to home health care right after that because there's not enough capacity for the skilled nursing facilities. They're going to go to a cost-effective care model, which is home health care. And at that time, the state of Illinois was paying lower than the reimbursement, the labor cost of a home health care model. Now, while that's happening, while the hospitals are struggling to find a home health care agency, home health care is being paid less than the labor costs in what we're in the Medicaid world, reimbursement world. What's happening in our office is we're getting a lot of phone calls of individuals, kids, daughters, sons of parents saying, listen, I know it's a financial model. I know it's business. I know it's money. But can you please take care of our parents? Can you please take care of our parents? And we'd say, of course, we're going to say yes. We're not going to say no. But the fact that they're asking this question the way that they did and the way they framed it told me that they've received a lot of no's first from a lot of different organizations before us. And that's because it was a business model decision from many home health care agencies. And what we take pride in is the two words that's attached to our logo, and that's patient safety first. Three words, I should say, patient safety first. Now, patient safety is preventing preventable medical errors, and our goal is to prevent preventable medical errors. So we said yes to many of the patients. And simultaneously, we're working with the health plans to let them know that, hey, listen, you're going to pay, you're going to spend a lot more money in readmissions. You're going to spend a lot more money on the cost curve for individuals increasing because you're not paying attention to this segment of the marketplace. And when we talk to them, many of the health plans wanted to utilize us and save money, not only the traditional metrics that was being governed at that time, but things that but other things like medication costs and more. And when they partnered with us, and so by doing so, we became exclusive for many health plans. And by being exclusive and being the top partners of many of these health plans, what we found out is that we addressed a very important need for a patient population that just at one point in 2011 didn't have any health insurance, but then 2012 they have health insurance. We address that gap and we address that model. So that's how we are different than a traditional home health care organization that works transactionally. We work to help develop a model of care with the healthcare organization, whether it may be a health plan or a healthcare organization. We work together collaboratively to help them achieve their goals. And when we work with that other collaborating healthcare organization, the patient wins.
Absolutely, yeah. Iqbal, I think BHN is doing a great job, okay, and for the patients. And really, I think this is something new that more patients should get access to is a priority. But what I want to understand is I want to go a little backwards, a little back, and look at your startup journey, okay? You had an amazing idea. You had an amazing strategy in mind, everything, but the actual thing is materializing your dream, implementing it on the ground. Maybe if you can walk us through that journey, how you, after getting the idea, how did you get it on the ground? What challenges you faced and what have you learned?
Absolutely. Good question. I briefly discussed some of the startup journey with the healthcare reform because I got the moment the organization started running on its own, those were the more earlier calls. We came at a time where healthcare was more accessible and for more and more people. So we got a lot of, so we, right off the bat, we solved the problem and allowed the patients to win. It took a lot of courage. It took a lot of crunching numbers. It took a lot of interviewing and putting things together to understand what the cost is for both the patient and the organizations that we partner with. But at the end of the day, it's all underneath the umbrella of patient safety first. That's the most important thing about our organization. That's really what defines our startup journey, our journey through the pandemic, and the journey that we're going to take the next 10, 15, 20 years from now is patient safety. How